Before we start, just a couple of housekeeping things. You must take the quiz to get CE credit. There will be a link that follows approximately an hour after today's webinar. I do have to make the following disclosure. I would like you to know that I am a part of Align Technologies clinical teaching faculty. I do not own stock, securities, or interest in Propel Orthodontics. None of my family is employed or owns any stock, securities, or interest in Propel Orthodontics. I have been a consultant and evaluated products for the following organizations: Propel Orthodontics, Align Technologies, and 3M Dental. Also, I need to let you know that I have been compensated for consulting and I am being paid for tonight's webinar broadcast. But who's talking to you tonight? Let me tell you a little bit about myself. I'm Dr. Regina Blevins. I am a graduate of the University of Michigan School of Dentistry and then went on to get a certificate in orthodontics from the University of Minnesota in 1991. I've been Invisalign certified since the year 2000. I am a Diamond Plus provider, and I am one of Invisalign's top teen providers. I've been an Align Tech faculty member and speaker for the last 2 years, and I am an adjunct clinical professor at the University of Minnesota, as well as maintaining a private orthodontic practice. These statements and views, opinions, and cases that I'm going to show you tonight are my materials. Align Technology or Propel Orthodontics may not endorse such statement, views, or opinions. You are responsible for any of the things that you take from today's webinar when you choose to use them for yourself. Aside from being a teacher and a orthodontist, I'm actually a mother of 4 wonderful children and a wife of a very sweet, kind orthodontist. Dr. Tom is a practicing orthodontist also in Minnesota, but we do not practice together, mostly because we want to stay married. My oldest son is in a dental hygiene therapy program here in Minnesota. My daughter Rachel starts dental school in August, and my 2 younger kids, one's in college and one is in high school, and they're not sure what career paths they're going to take yet. But suffice it to say, we're just like the average family that comes in and needs orthodontic care in your office. I know what it's like to be a working mom and have to juggle all these things. So I come from the area of dentistry with kind of a unique perspective. I was a dental hygienist before I was a dentist, so I kind of see the side that the staff sees in the office. I come from the side of being a working parent, and I can see that perspective as well. But tonight, what we're going to do is spend a little bit of time and deep dive into high frequency vibration. And I'm going to pepper the cases that I show you with also some of the science, because as a teaching faculty person at the University of Minnesota, when these things come out and they're being used in the marketplace with orthodontic offices, my residents will come to me and ask, hey, does it work? What is this? Has there been any research papers and things like that done on this area? And I want to tell you and share with you some of the things that I have found, as well as show you cases that we've treated in our own office. And I put this slide up kind of tongue-in-cheek, but really the vibration science did start with rocket science. As early as the 1890s, it was known that bone would adapt to loads that were placed on it. But really in the 1990s, with the NASA program and astronauts being exposed to very low or no gravity, they ended up having problems with their bone density and getting stabilization of their bones. And so they used high frequency vibration to make the bone cells activate and get less bone loss while they were in space and things like that. So that's where some of this research comes from in the really early days. But let's talk about some of the things that are a little bit more in tune with what's going on with us in dentistry. So some of the preclinical research that is out there was studies that were done with in vitro cultures, looking at the periodontal ligament fibroblast and looking at the difference between high frequency vibration and low frequency vibration. And this particular study from Stony Brook and Columbia universities looked at using an Excellident product versus the V-Pro 5 product. And just so that you know, the Excellident product is about a 30 hertz vibration, and the V-Pro 5 is at about 120 hertz. So they compared vibrating Petri plates with these cultures, and they found that they had increased cellular activity, certainly with the periodontal ligament fibroblasts, with the higher frequency vibration. Looking at the osteoblasts, they found the same thing, statistically significant increase in osteoblast activity with the higher frequency vibration. Just going back to that study, the osteoclasts were found to react about the same. Okay, so periodontal ligament fibroblasts and osteoblasts certainly had increased activity. Osteoclasts are not much different. Then another researcher looked at the osteogenic effect of high frequency vibration on alveolar bone, and this was out of New York University. And what they found was bone density increased more as the frequency level went up. And so this was a rat study, and they used the stimulation, and they found that, again, the osteogenic bone density increased as it went up higher hertz. And then the next study I looked at was high frequency acceleration when a tooth was extracted. Again, this was a rat study, and if you look at what they found with the high frequency vibration, they looked at an extraction site, and over time found that compared to a control, which is the static picture that's labeled here, that the bone density was much more significant in the areas where they had exposed the bone to high frequency vibration. So that's all exciting, and that gets your interest piqued as what really is going on with this vibration in the bone. So let that sink in a minute, and we'll look at our first case. Let's meet Thomas. He is a 55-year-old male with a diagnosis of a deep bite, some attrition, and he's seeking treatment because he would like to get some of the incisal edges of his worn teeth eventually restored. And we were treating him with a clear plastic aligner product and utilizing high frequency vibration. The high frequency vibration product that we used in this case was the Propel's V-Pro 5. We used a 3-day rate of change for his treatment, and our goals were to intrude teeth for restorative clearance, and then he was going to also need some gingival recontouring. For Thomas, we gave him an original treatment estimate of 15 months, and we were able to tidy up and finish his treatment in about 5 months. So let's look at Thomas's ClinCheck. As you can see, we utilized bite ramps on the maxillary arch to help with disclusion so that we could extrude our bicuspids and help with incisor intrusion. I'm going to play it through again. We did some mid-arch widening and uprighting teeth over the basal bone. We also utilized interproximal enamel reduction to help reduce the crowding. And let's take a look at our results. Here you can see we obtained a very nice arch form change. We resolved his lower crowding. We made a significant improvement in his deep bite and his anterior labial torque and axial angulation of his teeth greatly improved. And he is in a much better situation now to have his anterior restorations performed than he was pre-treatment. We like to think that we set him up for a nice, straightforward restorative case for his referring dentist. One of the things that I would encourage you to do if you're doing aligner therapy, whether you use acceleration or not, I'd like to encourage you to always take another scan at the end. I utilize that as my finish models, and I also will use that scan to tighten any contacts, any last minute bite settling or end of treatment bite settling. And the gray boxes that you see here on the end, those are what I call minimal movement aligners, or basically passive aligners. And what this allows for me to do is to have aligners that really don't move the teeth, maybe microns, because I really want retainers. And he's going to have restorative treatment done. So by doing this additional scan, two things it accomplishes for me. It lets me check how my treatment turned out, and is a very accurate set of study models. The other thing it does for me is it provides me with some retainers for him to wear while he's getting worked up for his restorative treatment and things like that, without me having to manufacture retainers some other way. So let's dive back into a little bit more of the research before we see our next case. This study looked at high frequency vibration used on a daily basis and how it enhanced aligner tracking. And I especially like this study because it was a randomized clinical trial, which I think is important because it takes some of the examiner bias out of it. So looking at aligner accuracy, what this study shows is that if you try to change your trays every 5 days without any kind of vibration, it's so uncomfortable that these patients they had to be pulled out of the study. So that's not something you really want to do. That's not a practice builder. But if you look at a 14-day change and a 5-day change with a high frequency vibration device, you get the same amount of accuracy. And you have that at a statistically significant level. Now, if you have a case and you're really trying to enhance the tracking and you want close to 100% accuracy on the tracking, a 7-day change with the vPro 5 gave as much as a 90% accuracy level on following the course of treatment that you prescribed in your ClinCheck. So to me, that was really exciting. What that tells me is that I can have a patient change their trays every 5 days. And if I start to see a tooth lagging, Then I just tell them to wear it 7 days with the V Pro 5 or the high frequency vibration device, and my accuracy of getting that tooth to seat will go up to the 90% level. So I really liked that study, and that's something that I really think that I should be able to use in my practice. Now, the other thing that this study looked at was the rate of tooth movement. With a 5-day change with the V Pro 5, you got a 68% faster rate of change, but your accuracy went down just a bit. When you look at that, the difference between the 7-day, where it was 42% faster, and the accuracy rate or the accuracy level is at 90%. So for just a 6% difference in accuracy, you can go quite a bit. You can go almost 30% faster. So again, that's kind of a take-home message there. You can utilize this technology and you can speed up your treatments, but if you see it causing an issue, then you can back it off for a few days and pick up a wayward tooth and then get faster again. So that's how I use it in my practice. So looking at this a little bit closer, if you take 14-day change as a baseline with a control group, and you do a 7-day change with no vibration, your accuracy goes down to 70%. And I don't think I want to treat at the 70% level. Okay, that for me wouldn't be accurate enough. The 7-day you get with the V Pro 5, you get the 90% accuracy, and then down just slightly with the 5-day change with the V Pro 5 at 80% accuracy or tracking. So, somewhere between 7 and 5 days is a real sweet spot. I would have liked to have seen if they would have extrapolated the study and maybe tried a 3-day change. I don't know what the comfort level or accuracy would that have been with that, but my curious mind says that's the next thing I want to see is what is the limit to this, and certainly we know a 5-day change with no vibration the patients couldn't tolerate. So with the vibration, where is that outer limit? And I'm sure somebody out there is going to do the study soon. And this is just a graphic representation of where the patient comfort levels and their pain scores rated. And as you can see, the most comfortable was the 7-day V Pro 5, but not much different was the 5-day V Pro 5. And certainly the 14 days by day 3, they're pretty comfortable already. And certainly 7 days without any vibration is tolerable, but certainly a 5-day change in this particular study wasn't tolerable for the patients. So another finding in this study that I think is very interesting is in all 7 bone remodeling markers, the vibration, the high frequency vibration patients showed an increase in the markers that they were looking at. And some of the markers showed higher in the 5-day change. Some of the markers showed a little bit higher in the 7-day change, but all of them showed an increase with the high frequency vibration. So in this particular study, using a vibration device, a high frequency vibration device for a minimum of 5 minutes a day, 3 important things could be concluded from these studies, in my opinion. The V Pro 5 can improve your accuracy while allowing you to reduce the interval between your aligner changes. The V Pro 5 high frequency vibration can reduce patients' pain and discomfort. And the VPRO 5 significantly increased bone remodeling markers and cytokines. So I think this is a very good study, and I'm interested to see in the future if somebody takes this one step farther and looks at some of the other parameters. But let's look at let's take a breather from the science and let's look at our next case study. This is Sam. And if Sam looks familiar, he's Thomas's son. So we had a father-son combo here. And Sam is a 21-year-old college student with some narrow arches and some lower anterior crowding. We're going to treat him with clear plastic aligners and a VPRO 5 high frequency vibration appliance. We also had Sam on a 3-day change rate, and we gave him an original estimate of 15 months. And our treatment time actually came in about 7 or 8 months. He had a first series that lasted 6 months, and then we did a revision that lasted about a month and a half. So let's take a look at his ClinCheck. Okay, as you can see, the same arch widening that his father had. We certainly have the IPR that we need here too. And what we see in 60 trays, changing every 3 days, a really nice arch form change. And you can see that it mimics what we predicted on our ClinCheck quite nicely. And we just about had all of the crowding resolved at this point. You can see we do have a little residual lower anterior crowding, hence the second series of aligners that we needed to order. Certainly looking at the frontal aspect, much broader smile and much better axial inclinations for his teeth. Certainly our overjets improved here and our deep bite is improved. So let's look at his second series ClinCheck. Personally, I don't like the phrase revision. It intimates that maybe something wasn't done correctly. So in our practice, we use the terminology first series, second series, third series. I certainly don't think that doing more than one series of aligners is a bad thing. I, with my patients, use a golf analogy. I say the first series gets us down the fairway to the edge of the green, typically. The second series gets us near the hole, and sometimes we don't have to have a third series, but if we do, it's usually just minor adjustments. But let's take a look at Sam's second series. So all we're doing is a little more unraveling of that lower incisor crowding, okay? And here we can see Sam's nice, big, broad smile. All right, so let's look at a few more studies. What we have next is a look at high frequency vibration and the effect on tooth movement and bone quality. And this study was out of the University of Alberta. And what we have is a study where the VPRO 5 was again used, and it looked at where the most movement would happen in the tooth while it was being used. So these patients were class 1 crowded patients. It was limited to about 3 to 5 millimeters of anterior crowding. and they were able to get successful treatment with an 8.7-day change without high frequency vibration, but with a 5.2-day change, they could get successful tracking and crowding resolution if they use the high frequency vibration. So very similar to what we saw in the last study. And in my mind, I start seeing a trend of what is happening when I look at these studies. Now, the next thing that this author looked at was bone density in between the teeth, and they measured that on CBCTs. And what they found was in between the teeth that they had targeted to examine, that they saw increased bone density on these CBCTs. Now, there's a lot of implications to that. And when I've discussed this with other orthodontists and certainly other orthodontists in different universities, one of the things we're wondering about, and I think it really needs to be studied, is does this increased bone density last, and does it lead to more stable retention in the long run? So is this something we can tell our patients that if you use this device, even after you're finished, and long after you're in retention, and you can keep the bone density high, does that mean your teeth will stay straighter? And will you need to wear a retainer with it, or can you just use the V Pro 5 type of device and keep the bone stimulated and the teeth will stay straight? So there's plenty of research material here for ongoing studies. The next study to look at was a bone marker to see if interleukin 1 beta secretion, did it increase during tooth movement? And what they looked at with this study was high frequency vibration and braces, okay? Because we also do orthodontic correction, not just with aligners, but also with brackets and wires. And in this study, they used, and I was kind of amused, they did not use a V Pro 5, they actually used an electric toothbrush. Okay, the electric toothbrush's vibration frequency was measured at 125 hertz, so very close to the same vibration frequency that the V Pro 5 was at. But what this author did, and these were split mouth studies in patients that had had a tooth extracted, and they held the toothbrush on the canine tooth as they were going to distalize it, and not right away, not right after the extraction, but it T1, T2, when they actually started retracting the tooth, they would hold the toothbrush on the tooth being retracted, which was typically the canine, and see if they had more movement or faster movement on the side of the mouth where they use the toothbrush as the vibration device. And lo and behold, they did have faster movement and bigger magnitudes of movement at each measured interval when they used a vibration device. So I guess, you know, a cheap, dirty version of high frequency device might be a toothbrush, okay? But how many of our patients want to go around biting on each tooth for 5 or 10 minutes with their electric toothbrush? It's just really not a practical application. But what it does tell us is that it's the high frequency vibration that really does stimulate the bone cells. The next study that I looked at was the effect of high frequency vibration on root length. And this is a retrospective study also done by this author out of the University of Alberta. And what he wanted to look at with this is, during using the high frequency vibration, do we get more shortening of tooth roots okay? Because it doesn't help us to do faster movement or use high frequency vibration and change our trays faster or change our power chains quicker if we end up with root resorption. And what this study showed was very minimal change in the root length. If you look at it, root lengths changed by half a millimeter or less. So not really statistically significant root length change. And in the control side, you also saw some root length change as well in some of the study subjects. So next we look at some studies again that were looking at pain and reduction in pain. And this is a clinical trial that was conducted by 4 different orthodontists in 4 different offices and then brought together to see if there was a trend that was apparent. And in this multi-clinic trial, what they did was they surveyed the patients, and it was kind of an interesting study because they delivered trays, aligner trays, and they told the patient to skip one and go right to the next tray. And then they had them use a high frequency device with some of the study subjects. And the ones that skipped a tray and used the high frequency vibration didn't have discomfort. The ones that didn't use the high frequency vibration device described much more pain. So again, it circles back around that the high frequency vibration, maybe like massaging sore muscles, certainly stimulates blood flow and probably reduces the pain response. Then the subjects in this study continue to use the high frequency vibration device, and most of them reported either very little pain or no pain throughout their subsequent aligner changes. So 97% of the subjects said either complete lack of pain or almost complete lack of pain. And 83% of these subjects in this study, and there were 75 people in the whole study, that said that they would recommend using a high frequency device just for pain and comfort alone. The next study looked at the tracking and how well high frequency vibration affects tracking of teeth. And what this author reported was that the use of the vPro 5 in this pilot study, measuring tooth position with ABO scores post-treatment with scans and superimposing them using a vPro 5 and 5-day changes, that he was able to treat more patients without any refinements, and found that the tracking was much better using the vibration. The control group in this study had more refinements and an average treatment time that was not quite double, but close to double than the study subjects. So this just shows that it was statistically significant. They used a 5-day change versus 4-day, and again used a digital scan and then a follow-up digital scan, like I like to use, to evaluate the actual treatment tracking of the case. Now, here's something else that this author put in this report. And I have to share with you today, as ironic as it is, I use this tip myself. If you have a patient like this doctor did that comes in and has some relapse. Now his came in 1 year post retainer delivery and lower teeth had crowded again. What he did was have the patient use a V-Pro 5 and look at seating those aligners. And after 10 or 15 minutes with the vibration, the aligner was able to seat. Okay, so here you have him a picture of the aligner midway down, and after using the V-Pro 5, this is the same day. Okay, now you need to keep using that to get the bone to remodel and for that to be a complete correction. But I can tell you from personal experience today, here's my story. And it's, like I said, so ironic because I knew I was talking with you tonight. It's finals time, and I practiced today in a college town called Northfield, Minnesota. And one of my patients came in, and she's getting ready to go home from college. And I had been treating her, while she's at school, and she hasn't been wearing her aligners now for about a month and a half, she confessed. We were at the end of treatment, and I was getting ready to deliver her retainers and send her on her way home back to her parents. And she told me, my parents are going to kill me because I haven't been wearing it. And what is it going to cost to get this fixed? And what am I going to say to my parents? Well, I have college-aged kids, so it pretty much broke my heart. But what I told her is, let's see how close we can get your aligner down. And I want you to sit here in this back chair for 10 minutes. When I come back, we'll see if we were able to get it down. And I'll tell you that 10 minutes later, the aligner was fully seated, and it was about the same amount of crowding that you see in this case here. I did send her home with the V-Pro 5. I told her I wasn't going to bill her parents for it. I was going to bill her for it because, you know, she's an adult at this point, and I'm going to be very kind to her. And I told her that she can pay us a very nominal amount a month, but that it would be our secret, and her parents will never be the wiser. And I really am impressed with this technology to be able to offer this to someone like that who was excited about being done, but then disappointed because she was human and made a mistake. So anyway, that's me on my soapbox, but let's look at our next case. Let's meet Nancy. Nancy is 59 years old, and she had had orthodontic treatment as a child. And during her childhood treatment, they had taken out 4 bicuspids, and she said that her teeth had been beautifully straight for many years, but slowly over the last decade or so, that her teeth had started to crowd, and she was a little disappointed in the fact that now her teeth were crooked. So we're offering her clear plastic aligners with a high frequency vibration device, the V-Pro 5, and some lower IPR. Now, for Nancy, I played around with the staging a little bit with my Invisalign, and I extrapolated out a 3-day change rate and got it down to a 2-day change rate. So let me be perfectly clear. I increased the number of aligners from what I thought a 3-day change would be to a 2-day change. Okay. Our estimated treatment time for Nancy was 18 months. What we ended up doing was treating her in 6 months. So let's take a look at how we did that. Here is Nancy's arch form change. Here is her improved crowding. Here is her axial inclinations and her mid-arch narrowing improved, and her anterior crown torque corrected. Okay, here is her finished scan. So you can see that we resolved the crowding and we broadened her arch. Now let me go back here, and you can see that she had a rotation of her lateral incisor here, marked crowding on her lower anteriors, and here is where those lower anteriors finished up, okay, in 6 months. Here is her smile, and we have put her back somewhat to where she was when she finished her orthodontic treatment in her youth, and she's quite happy to have her teeth straight again. Let's look at another case study. This is Kristen, and she is a 23-year-old college student again. And she is disappointed. She feels she would like a little bit broader smile. She's got some, what I would call mild crowding and some moderate lower anterior crowding. Again, we're treating her with clear plastic aligners and high frequency vibration. We did have her on a 3-day change, but Kristen is very honest, and she said, yeah, some days I changed 2 days, some days I went 4 days. And I would guess that that's probably true of a lot of our patients. When we give them our prescription, they play a little attitude with it, and at least Kristen told me what she did. We did estimate a treatment time of about 12 months for her, and she came in at 6.5 months. And looking at her ClinCheck, you can see the IPR that we used, the proclination that we did, and the arch widening that we were able to accomplish, okay? Let's play that through one more time so you can take a peek at it. Mid-arch widening, unraveling the maxillary anteriors, lower arch widening, and then IPR to resolve the rest of the crowding. And here is our upper arch form change, and you can see we've rotated in that maxillary lateral. And on the lower, we were able to resolve her lower crowding. We improved her deep bite, and again, we uprighted the teeth over the basal bone somewhat and improved the axial inclination of her posterior teeth. Her overjet improved, and you can see that she has very nice posterior interdigitation. Again, I did a finished scan so I could document our results, and also in this particular case, I wanted to close some residual contacts between her teeth. Whoop, let's go back. So this additional aligners were, about a month more of doing those last few goals. So here is her finished smile. And she was a beautiful girl to start with. We just put the icing on the cake. And the high frequency vibration device that our practice has chosen to use is the vPro 5, if you haven't guessed that by now. Why did we choose this? Well, we've seen in our practice, and it's backed by some of the research that I've shared with you tonight, that it reduces pain. It will likely reduce refinements. We've certainly, in our mind, put to rest that it does reduce treatment time. from the research, I feel fairly confident that it does help with bone remodeling and does increase bone density. It's an easy appliance to use. It's one of the things I like about it is that it's simple. You assign the device to the patient, and then you can access the data and see really if they're using it or not. I like that feature. And you can get a summary of how often the patients have used it and how faithful they are with it. It is pretty streamlined and simple. While it's in the mouth and it's working, it's got a self timer. The blue light will come on for the 5-minute cycle. If you want to do 10 minutes, you can just turn it on a second time and do 10 minutes. So depending on what your comfort zone is or what the patient wants to do. I'm not aware that there's any ill effects of using it too much. I haven't read anything that would support that, so I think it's safe. If the light shines magenta, it needs to be charged. If it's amber, it means it is charging, and if the light is green, it means it's fully charged. That's about as simple as it can get. Now, if it is red, that means that the patient has paused it, and they can certainly pause it as long as they turn it back on to use it and they haven't lapsed for more than 30 minutes. Say they had to go answer the door and they took it out of their mouth for, 5-10 minutes, put it back in. They don't have to start over to make it be a cycle. But if they go longer than 30 minutes, then it will reset and go on an additional 5 minutes. It's charged via a USB charger, so that's simple as well. Now, we have decided at our practice that at this point we're convinced enough with the science and what we've seen with our own patients that we're using this with all our adult patients. It's not a hard sell. We just simply include it with our fee. Now, in all transparency, yes, we did raise our fee a bit to cover it. But rather than adding it as a line item tack on, we want our patients to use it, and we don't want to have the uncomfortable conversation of, oh, and buy this too. So it was easier for our office to say, this is our fee, and oh, by the way, it does include this, and these are the benefits ABC of using this. We haven't rolled it out for all our teen patients yet. But we want to just really see how, from a business standpoint, it works with doing that with our adult patients. And usually we'll give something like that a good year and then make the decision if we are going to roll that out to our teen patients as well. But this last case I want to share with you is what I termed in our office kind of our think outside the box case. And why do I say that? Okay, I want to introduce you to Carol. She's our last case we're going to talk about tonight. And she's a 50-year-old female whose arches were narrow and who had upper and lower crowding. Again, she was interested in clear aligner therapy, and we decided we were going to give her the V Pro 5 to use as her high frequency vibration device. But what we did with Carol is we extrapolated out what our 3-day change rate would be with aligners, and we ended up doing daily changes with Carol. Now, that is not an Invisalign approved protocol, I'll say right now. But what we did with Carol is, she's a kind of person that did not want to fool with anything icky. Okay, she didn't like the idea of having to brush these things and whatnot. So she made me think outside the box, and I said, Carol, what if we gave you an aligner for every day? And her eyes went wide and she said, "You mean like a daily wear contact lens?" I said, "Yeah, what if it's like a daily wear contact lens?" And she said, "Oh, okay." So that's what we did. So if you think about the normal rate of change, she's kind of a 3-day change, even though technically we did a daily change, okay? We estimated a 15-month treatment plan for Carol, and we were right about at the 6-month mark with her. So when you see 91 trays, yes, she had 91 trays. Why 91? Because about 99 is all Invisalign will make for you at any given time. So that's how many we were limited in ordering for her at once. So this is the arch widening that we were looking at, and you'll see changes are happening very slow. But remember, each one of these blue boxes represents a day. So in 90 days, she finished up with this much change, okay? So we had broadened the arch slightly and started to work on our rotations. And then we ordered her next set of daily change aligners. And now that we have the arch widening happening, we introduced a little bit of IPR and we unraveled the remainder of the crowding. Okay. So she's changing daily. She's using her V-Pro 5 daily. And at the end of 183 days, this is what we saw. We got a nice arch form change in the maxillary arch. We resolved our lower crowding. We widened our mid-arch. We extruded our lateral incisor, which is one of the key teeth that we struggle with aligner therapy, is getting lateral incisors to extrude. We maintained our nice interdigitation in our posterior segment, and we have improved anterior torque and certainly enhanced aesthetics for Carol. And then this is my follow-up scan, my final study model. Some minor little things I want to tighten up with her over the next 12 days. And so we ordered a few more aligners, but as you can see, a very, very nice result in 183 days. So I want to leave you with these thoughts before I open it up for questions. Think about how you can bring these innovative new products into your practice and enhance your patient experience. Because the more comfortable they are, the more satisfied with their treatment, the more they're going to brag about you. And patient satisfaction, I think, is the secret to a successful practice. And the last thought is, we don't know what the walls of the box are yet. So when I say don't think outside the box, think like there is no box, we don't know what the boundaries of what science is going to offer and where we're going to go with this. And I like to think that we're just entering the age of orthodontic treatment now, where we can bring our patients faster, more comfortable, enhanced treatment. So with that final thought, I would like to open things up for questions, and I will be here for at least the next 10 minutes, available for anyone that would like to shout out a question to me. Okay, we already have some questions in. The first question, oh boy, I like this one because I have gotten asked this before. The question is, how do you get Invisalign to make 4 passive aligners? And is this smart track? And how do they last? Well, they're not uh, technically passive, okay? What I do is a scan for revision aligners and I pick a tooth. It could be a second molar, it could be bicuspid, and I make very, very tiny adjustments to it, imperceptible adjustments. And I ask them to make that change over how many ever aligners I want. And 4 is just a number that's arbitrary. I think they'd probably make me 6 or 7 or more if I asked, but I don't want to take advantage of the situation. Really, what I'm doing is trying to have them wear these aligners, one, to make sure they're completely satisfied with their treatment before I make their final retainers, which I think the Vivera product is a wonderful retention of product. I've had, as far as addressing how long these last, I've had some patients that say they've worn each one at night for a month or so. Depends on if they're a clincher grinder and how well they take care of them. But they certainly can last for a while for the patient to really look at things, decide they're finished, or long enough for them to go and have a dental checkup and know whether or not they need any restorations or things like that. Nothing more disappointing than doing the final retainer only with vacuform retainers especially, and then find out that they're going to have a crown or something done, and then we got to redo it. So that's how I use them. The next question I have is, what attachments are you using on these patients? And I got to be honest with you, I don't change my attachment protocol at all. They're the attachments that I would use for any normal aligner case. So I don't beef them up. Where optimized attachments, where I would do that if I'm not using an acceleration device, it's the same attachment. If I think I need a conventional attachment and it needs to be beefier, then I use that. I don't make that decision based on whether or not I'm going to use acceleration. My attachments are my attachments. Good questions, though. Glad you were paying attention. So it's a beautiful night here in Minneapolis. It's about 75 degrees, which in our neck of the woods means we're sleeveless and we're on the patios. So I hope it's wonderful also wherever you are. And I'm going to give it about 3 or 4 more minutes to see if there's anybody out there that has another question. If you think of something later that you want to ask about, please feel free to look up Minnesota Orthodontics. That's my practice name, and you can reach me via my practice website. Otherwise, if you have a Propel rep in your area, you can certainly ask them questions. And the research papers that I talked about tonight, if you have any further questions on them at all, would like to read them yourself, which I encourage you to do, you can certainly reach out to your Propel rep and they can supply those resources for you. I don't see any more questions coming in, so I'm going to bid you all a wonderful good evening and thank you for sharing the last hour with me. Good night.